If you broke your hip or suffer from arthritis in your hip joints, you know what's ahead of you: surgery for hip replacement. If that procedure is in your future or a loved one's future, you might want to check out another option being offered at Grant Medical Center in Columbus. Joan Hornbeck is nearly 70 years old and an avid tennis player. She was determined that hip surgery wasn't going to slow her down. Dr. Kusuma offered her a solution that fit into her active lifestyle. Not total hip replacement surgery, but hip resurfacing, a new procedure which allows a greater range of motion.
And so you remember before the surgery, if we turned it, you didn't have near that much motion, but now, and even that way.
Joan had surgery only 7 weeks ago and is walking and moving without pain and has healed quickly.
She's playing tennis already and apparently was seen dancing at a wedding this past weekend with none of what she's supposed to be doing.
But Joan's excited about getting back to her tennis, and she credits her new hip with giving her back her game.
With a resurfaced hip, after a year, it's almost like your regular one. And it's usually for people that are younger, that are 60 and younger. But fortunately, my bones are good. It's just that my joints are terrible.
The Birmingham hip resurfacing system was developed in England and received FDA approval in 2006. Dr. Kusuma acknowledges that it's a delicate procedure, but he spent a significant amount of time learning from the people who invented it.
Can I relax your hip for me?
Standard hip replacement is the usual prescription for patients with arthritis and other conditions or injuries that cause the joint to become rough and worn. Total hip replacement patients are restricted in their activity and encouraged to stay away from high-impact sports such as running and skiing. Dr. Kusuma agrees that traditional hip replacement is still the norm and is effective in most cases.
Then we take a stem like this, very similar to this one here, with a metal ball head at the top, and then plant it into the thigh bone as so. And then we place another socket in here, a metal socket with a plastic recipient socket, and we put it together, and voila, magically we have a new hip joint. And you think, is it possible this actually works? But it really is amazing. Again, the effectiveness and the pain relief and the functional benefits that people get is absolutely phenomenal.
But for those people who are young and active, the new hip resurfacing is easier on the bones and your lifestyle. It's less invasive and allows more freedom of movement.
The bad bone's only at the very, very top. I don't need to take all this extra, and I don't need to put a pin all the way down in the femur to treat the bad bone at the very, very top. And instead of putting a big pin down in the femur all the way down, just take a little metal cap and cap the top. That seems to make sense to me.
Dr. Kusuma performs his surgeries at Grant Hospital's Bone and Joint Center, which is undergoing a major $14 million facelift. The exterior and interior of the center will be upgraded. The renovation will improve patient flow, provide private patient rooms with their own bathroom and shower, and new surgical areas will allow families to remain with their loved ones through surgery and recovery. The renovation is scheduled to be complete this summer. As for Joan, she's very pleased with her new hip.
Oh, I love it. And we also, Kusuma and I, Dr. Kusuma, we have a tennis date next April, and I'm going to beat him.
I think you will.
Oh, you're darn right.
You go, Joan. If you would like more information on hip resurfacing or the Grant Medical Center, you can log on to our website. You'll find more information on Grant, Dr. Kusuma, and the Ohio Healthcare Network of Medical Facilities.